Rafael Martinez. I am a research fellow at the Lee Kuan Yew Center of Innovative Cities at ASUTD. On behalf of the center and my colleagues, Dr. Harvey and Mr. Winston, I would like to thank you for joining us for Reimagining the Urban in the Post-Pandemic Era workshop. I would like to welcome our online audience, both in Singapore and globally, students, friends, and colleagues of SUTD. For those who are joining us today for the first time, the workshop is envisioned as a platform to foster knowledge, sharing, and partnership opportunities between Southeast Asia and Latin American stakeholders. In this focus series, we explore discourse on a diverse and broad range of emergent contemporary health issues brought about by the COVID-19 pandemic. In this second day of the workshop, focus on imagining the post-pandemic city, shifting conversations and calls for action. I'm honored to introduce our panelists. Well, I have to say that we were expecting Professor Alejandra Vives Vergara from the Pontifical Catholic University of Chile, but we haven't heard from her, but hopefully she will join us at anytime soon. But we are very happy to have Suryono Herlambang and Wahyu Kusuma Astuti. Mr. Herlambang has an extensive research on urban and regional planning, urban theory, and architectural history in Indonesia. Mr. Herlambang and Mrs. Kusuma are both lecturers and researchers at the Faculty of Urban Planning and Real Estate, University Tarumanagara in Indonesia. I'm thankful to our panelists for taking time off their busy schedule to accept our invitation. Next, my colleague Winston will explain the modus operandi for this session. Winston?
Thank you, Rafael. So the session will proceed as what we have seen over the past day if you've joined us yesterday. So the first 30 to 35 minutes will be a roundtable active dialogue led by the moderator with the panelists. So for the later session, the later 20 to 25 minutes, it will be an open Q&A. So we encourage our online attendants to submit any questions that they might have throughout the session. So you don't have to wait till the end of the session to submit the questions if you have any. And it'll be good if you can submit the questions early as well. And we will take those questions in the latter half of the session. And also another point is that the sessions will be recorded and it will be uploaded onto our website. And also copies of the recording will be provided to participants upon request. So without further ado, I will pass the time over to Rafael to kick off with the first question for our panelists. Thank you.
Thank you very much, Winston. So as you know, today's first panel is infrastructural reform and guaranteeing accessible and inclusive health infrastructures and regulations. So Herlambang and Wahyu, let me give you like a sort of a background and to hear your comments. Later, as Winston said, there will be like a questions and we will start the conversation. So this is the background. So health infrastructures are used in the UN Habitat and the WHO sourcebook integrating health in urban and territorial planning. Can be interpreted as basic infrastructure that support and secure long-term health and well-being legacies for growing human population. They include having a qualified health workforce and health agencies, efficient information systems, provision of open space, availability of hospital beds, clean water, sanitation, and hygiene facilities. So in this discussion, we would like to focus on the built environment aspect. Particularly, recent discourse has highlighted Build Back Better initiatives to create a more resilient and healthier city that reflects new social and economic behavior. For example, people choosing to spend their leisure time in open spaces instead of indoor malls, and people working from home instead of going to the office. For many cities, the need for safe distancing has also forced a shift towards more sustainable forms of transportation. So these are the topics that we would like to bring to this conversation. Regarding your city, in this case, of course, Jakarta, and its urban environment, what do you think are the biggest changes that we will see in health infrastructure for the coming years? And there is a second question that it could be related. What do you foresee as barriers towards implementing these changes? So let me repeat, Herlambang and Wahyu. So regarding your city, Jakarta, and its urban environment, what do you think are the biggest changes that we will see in health infrastructure for the coming years? And what do you foresee as barriers towards implementing these changes? Okay, so who would like to start? How about Herlambang? You are muted.
Sorry, thank you.
No problem.
In case of Jakarta, Rafael, I think we have two fundamental issues in infrastructure. First, in physical infrastructure, especially with transportation and mobility. Before the COVID, there is a quite fast development in Indonesia and Jakarta. We start to operate MRT. We also just have Trans Java Toll Road, you know, the massive toll network from Surabaya, from Jakarta in west and to east East Java is very massive and quite make a difference fundamental in the Java Island, especially in mobility and also in the economic development, and also the connection between regional area. The second, I think Indonesia also we start to rise, we call as a digital infrastructure ecosystem. We have several we call unicorn startup company. It's like Gojek, you know, Gojek is very, very phenomenal in Indonesia. Start just as a private motorcycle transportation, now mushrooming to the other services. So digital ecosystem also thoughts in the healthcare system. The telemedicine, what we call a startup, also very fast developed in Indonesia. We have Alodoc and also medical, all use the digital appliance. And also in terms of the national program, we have national health insurance. To the 2019, we found the data that more than 82% of the population covered by this insurance. So before the COVID, is luckily Indonesia, we quite have not strong, but readiness for the infrastructure for health and the other. So, you know, also the big news perhaps in Indonesia, also in Southeast ASEAN, in August 2019, that President Jokowi planned to relocate our capital from Jakarta to East Kalimantan. I think it's the idea of the President Jokowi. It's present our self-confidence before the COVID. But after COVID, we know everything canceling that some contradiction when the infrastructure of the transportation are good. There's a way for the spreading of the virus. But the other thing that we thanks for the infrastructure that our micro and middle economic group is quite to catch with the digital ecosystem that we can quite survive to face with the pandemic. I think this this condition noise become our position when we think to the future. Thank you, Rafael.
Yeah. Thank you very much, Herlambang. Wahyu, any comments?
Well, yeah, thank you. I agree with what Pak Herlambang has mentioned. Actually, health is situated in a complex relations with other infrastructure and the whole urban transformations. Yes, that's right. So, Rafael, you previously mentioned about workforce, open space, hygiene, but health is actually also related to how people mobile within the city. So, because I had this personal experience of riding at the front seat of an ambulance with COVID-19 patient. And from that perspective, you can actually see how street density and connectivity really, influence the mobility of ambulance and patient to hospital and to other health facilities. And it's actually harder when you are in a suburban area where street connectivity is not is as regular as the ones in the urban area. So I think there are many everyday experience on infrastructure that really influence health system in terms of its large infrastructure. You mentioned also about hygiene, yes, water, but you might also have heard from the previous keynote speaker that Jakarta has the lowest coverage on pipe water, but it is also the most expensive. So recently, of course, I mean, in the city center, there has been a very low coverage of water, but people never really talk about how it is in the suburban area, right? So recently there is this new dam construction in Ciujung River to supply water to Serpong area, which is growing very significantly these years. But we're not also sure whether this kind of large infrastructure will solve the water coverage, the lacking of water coverage. So health system actually links to many kinds of large scale infrastructure, which also have implication on land availability, land acquisition, financing, and so on. So I think if we look into the detail, there are many things which you probably would assume as the barriers, like how infrastructure related to health system would have implication on land, on finance, and on housing, and so on. I think that's my argument. I think we're losing Pak Herlambang here.
Oh, okay. So yeah, you're right. We cannot see. Oh, okay.
Hopefully he can rejoin the session. I think maybe it's a connectivity issue.
Yeah, it's a connectivity issue. So, okay, so I think we can continue. Well, so maybe Winston, you want to continue with the next question with Wahyu, which is, I mean, who is still here?
Yeah, Herlambang is back.
Okay.
Yeah.
Bye. So glad to hear.
Connection.
No worries. Okay, so Winston.
Yeah, so building on what you said, I think it strikes me as interesting, like the multifaceted interactions of the health system. So this brings me to my next question on flexibility. In your opinion, has Jakarta's health infrastructure been flexible and adaptive? And if not, do you think there's a need to design a brand new health infrastructure system that can be flexible or adaptive? So maybe the first one to respond can be Wahyu this time. Yeah.
Okay, so in terms of flexibility, I think we can see it from for example this. So we had, for example, we had this infrastructure post Asian Games infrastructure, like the housing complex for athletes. that was operated in 2018 when the Asian Games kicks in. And so for 2 years after the Asian Games, there has been no decision about what it's going to be. There are many arguments about how it should be used for low-cost housing, but there are also other debates saying that it cannot be for low-cost housing because the facility is meant for international standard, and then the maintenance fee is quite high, and then it cannot be operated for low-cost housing, and so on and so on. Until then, it's not decided. And then the pandemic broke out. And then the government can use that asset actually for emergency hospital, for quarantine, self-quarantine, and also for healthcare workers who are on duty. So I think that can be seen as one of the flexibility of infrastructure when there's an underutilized asset that can be used for emergency for a quick response. I think that is one of the example for flexibility. But we also know that there are other kinds of shocks which are needed to be responded in a long term, like what you mentioned before, that infrastructure has to be adaptive, that it has to mitigate long-term disaster and multiple shocks rather than just spontaneous, because we do not have that kind of facilities in many ways. We really need to rely on a more adaptive for a long-term strategies for multiple shocks, because we're not only facing COVID-19, we also have flooding in Jakarta, for instance. We also have sea level water rise. So those kind of shocks, we need to respond them with long-term infrastructure rather than just a spontaneous or non-permanent solution. I think that's my opinion. Thank you.
Great, thank you. So now Herlambang.
Yes, Winston, I think the integration between conventional health facilities is like hospital, clinics, and digital healthcare, I think should be in the future more integrated. In the time of the pandemic, hospital is become like a scare place for the other people who didn't get the vaccine or the virus. So in our experience, my family also use the services from telemedicine, especially for the more light sickness, and also for the medicine facility. So I think the future we need integrated between the conventional, we call as a hospital or so on, with the digital healthcare services. Yes, thank you.
Thank you very much, Pak Herlambang. So I think maybe we can ask another question before we pass. We open for the Q&A. So this is for you, Pa, and of course for Wahyu. How can we design health infrastructures to be more inclusive for communities? Pa, would you like to start?
Sorry, Rafael, can you repeat?
Yeah, sure, absolutely. So how can we design health infrastructures to be more inclusive for communities?
Yes, in case Indonesia, I think we have two different conditions, especially in the metropolitan area. I think the digital infrastructure still ready for implemented the integrated between the digital and conventional. But I think in the other region of Indonesia, we still have the lack of the digital infrastructure, Rafael. So it's not easy to make what we call inclusive services to all of the people in Indonesia. But for me, I think we more optimistic in the big city. It's like in the region who still has the digital infrastructure, and but we also luckily, that our national health insurance start to develop. So I think in the future we can improve this kind of the national health insurance to more advanced in this services. Yes, Rafael.
Thank you very much, Wahyu.
Yeah, I think what Pak Herlambang mentioned was right, that we have an advancement of digital infrastructure currently, which can also make things cheaper and then also affordable for many people. We have hard infrastructure development like toll roads and MRT and LRT, which is the mobility of people and also operate on not a very expensive rate. But most importantly, I think we have the most important modality, which is the social infrastructure, which make sure that although that perhaps the digital literacy is not very high or the physical infrastructure coverage is not very high, but people are very willing to help each other. Like even, I mean, yesterday the keynote speaker mentioned about the charity activity, but it is actually not only about charity, but the whole government's local and national government actually plan out a system where local leaders at RT or RW, the neighborhood level, they can monitor and they can report who in the neighborhood are caught the virus, and then what kind of support should be given. I think it's very important during times like this that we still have that kind of social solidarity implemented from the structural approach, not only from the humanitarian approach. Thank you.
Very good. Thank you very much. Well, Winston,
Yeah.
I think we can, you have a question before we pass to the Q&A?
Yeah, so we are approaching the midway mark. So after this question, I will open the floor to Q&A. Then we will take questions from the audience, and you can raise your hand as well to directly voice your questions. So before we go on to Q&A, like hearing about your experience in Jakarta is very interesting. And also based on our work, we have been, part of our research looks at informality and we are exploring informal modes of health infrastructure. So for example, one of such is the Jamu Clinic. So based on your experience living in Jakarta and also being a resident in Jakarta, what do you think is the role of informal modes of health infrastructure within these new circumstances such as COVID? Thank you. So maybe we can start with Herlambang first this time.
Yes, we always a big debate about the informality, Winston, that some in a good way, but the other, we very careful with the what we call as informality, especially in health services, because I remember that perhaps you have read one of the interesting article in the New Life Review in the early of the COVID. There's a interesting article, Lemongrass and Prayer. It's what cover what the first response in Indonesia when the COVID is coming. The article said that most of the people believe that if we drink the jamu with lemongrass, ginger, the COVID, but the reality we cannot use this one. So in Hartley system, I think informality is quite, we should more careful to think about this topic. But the other in the economic development, I think informality is one of the a good answer to face with the pandemic. If we don't have informal sector and not integrate with the Gojek, is become the worst thing in Jakarta. We can go, we can get the food, but informality is like the good answer in the pandemic era in Jakarta, I think, and also in most of Indonesian city. Thank you, Wilson.
Thank you, Wahyu.
Yeah, I mean, when you mention about informality, that means also we are looking at a multifaceted, aspect of informality. When you mention about jamu, of course, it is an alternative approach, which is probably more affordable and easier and closer to the society, so that they can actually accept that, rather than if they are given, medication or something else. But we know that in the beginning of COVID-19, like Pak Herlambang mentioned before, that it has been a huge debate about whether we can actually avoid this virus with COVID as being suggested by the government, or to what extent this kind of medication or jamu can actually help us with the virus fight. But in terms of other things, like people in informal settlements, they also actually have they are also recorded for healthcare facilities and healthcare subsidy, so they can actually access healthcare. So in that sense, it might not be suitable to call them as informal, because they are actually recorded and they can access healthcare facilities. But in other things, maybe if we talk about water supply and then hygiene, sanitation, of course, people in the informal settlements are the most prone when it comes to hygiene, because in Jakarta, water coverage is very low and it's very expensive, especially for certain kampung. The water pressure is not high enough to supply water to the kampung, and so water price becomes more expensive in that area rather than in other area. I think when we talk about informality, there are many sites that we need to, we need to unpack. Thank you.
Very good, Wahyu. Thank you very much. Before we pass, we open for the Q&A. Perhaps Dr. Neo wants to ask a question. Harvey? Or maybe we can. Yeah. Before Harvey, you are ready, or?
Yeah, I'm ready. I'm ready.
Okay, very good. Harvey,
you can hear me, right? Yeah. So thank you so much. I'm so sorry I couldn't join the first day of the workshop. I had a family emergency, but here today. So I appreciate Herlambang and Wahyu present. The question or the comment I have in general is.
Sorry, Harvey, we cannot hear you very well.
Sorry. Let me see with my mic. The question I have is a general comment, which is about fact and fiction in this whole pandemic. We mentioned about non-conventional medical treatment, whether it helps and to what extent it helps. It certainly doesn't prevent, but whether it helps to moderate the effects of this. I mean, there is some truth in that, but it seems that it is difficult for the ordinary person to really come in tune to what is the truth and what is not. And of course, we have politicians, very important people, saying outright lies about the pandemic, all aspects of the pandemic as well. So I think in this situation, it seems like more so than ever, a pandemic condition is a free-for-all to really capitalize on the circumstance to either relinquish responsibility or just to be outright irresponsible, so to divert attention away from oneself. That's what I see. But I mean, that is a very cynical view. But even if we were to take a very, a guarded approach to this, it is still true that the medical field, they haven't been able to ascertain the very dimensions of the virus until very recently. The American CDC just confirmed that, okay, the virus is airborne. Almost a year after the virus, they could finally confirm that it is airborne. So given this kind of context, I think it's very hard for people not to fall into belief of whatever they want to believe. So I know this through personal experience, because my mother surfs the YouTube, internet, and all that, and she believes everything that the YouTube says without knowing that YouTube has an algorithm that really pushes the kinds of things that she reads, and she thinks that she's gathering evidence, whereas it is the big data algorithm that is pushing the evidence to her. I think this is something that is much obvious now than before. So it's not a question, it's just a reflection of the pretty dismal state of knowledge acquisition in this age.
Very good, Harvey. Any comment from Pa Herlambang?
Okay, Rafael, I interest with the comment of the Dr. Neo. In Jakarta case, I think the problem of healthy, not just in the physical healthy, also in mental healthy, Dr. Neo. That I think is more spread and more massive problem, especially for the young people. Then that they should have in home for the long time. Yeah, and in Indonesia also we don't have many public space for the we can just breathe the fresh air. And we yesterday Marco gave the picture about our public beach in Jakarta, Ancol. It's like in India. There's the other problem, I think, in the infrastructural city, but not just in medicine, but in the mental health. Yeah, we know in Jakarta we have a tradition about car-free day, but just in the small area, not spread in the whole city. So I think the other thing, the other important thing in the case of Indonesia, we should think about the problem of mental health for the urban people. Then in Tarumanegara, in our center, we start to research about the possibility to revitalize, or we connected all of the small element, natural element in the city to make a linkage, and then people can use the space or the place to I think for the what we call face with the problem of the stress, urban stress in every day. This is a current research in our center, Rafael. Thank you.
Thank you very much, Dr. Herlambang. Wahyu, any comment from what Harvey mentioned?
Yeah, I mean, Dr. Harvey was right about how our national actors promoted alternative medications in the beginning of the pandemics. But you're also right that it's not proven until now whether it can cure the virus, or whether it really helps you with your body to prepare for the virus. But there's this whole lot of debate about how it was only a distraction to the real problem in the beginning, because people were, the national actors were very reluctant to accept that there is this something important coming. And then they tried to, calm down the public and say that this is something that we can avoid. This is something that we can handle, things like that, through bringing the discourse on alternative medication. But you also mentioned about how digital literacy is also important, although that many people in the urban area are connected to the internet, but it's still not clear to what extent they could understand what they are sharing, what they are looking on the internet. People easily transfer forward messages, hoax messages through WhatsApp without actually knowing whether it's true or not. So I think digital infrastructure is important, digital coverage is important, but the other thing that government would need to tackle is that people also have to have the digital literacy. I think that's my opinion.
Okay, very good. Thank you very much, Wahyu. Winston, I think it's time to pass for the Q&A to ask our audience if they have any question.
Yep. So I think currently we don't have a question yet, but I have a question. Like after listening to the ongoing conversations, and seems like we're falling into a dystopia where physical health is treated as a foregone case, and like now there seems to be a need for more, like people are starting to recognize that there's a social debt as well to society because of this pandemic, and the social and mental health particularly has suffered quite a lot. And in ongoing national strategies to improve the health system, there seems to be an underemphasis on this aspect of social and mental health. So my question to the panelists is, what do you think the government should do to revamp the health system to support these dimensions of health? So maybe we can start with Herlambang. Thank you.
It's difficult question, Winston. What the government should take with this problem. It's not easy because in especially in national government in Indonesia, President Jokowi in the first period is more focused on the heavy or macro infrastructure because Indonesia is lack in this area. And the second, the public space issue is more political issue in Indonesia, especially for the local government. So we call as a quick program for the what the mayor or the region who elected in the local election. They start to beautification of the area for the public space and so on. But it's not significant progress for the make the city can face with this problem for the social and mental health system. So I don't know in the sense of the psychiatrist medicine approach, but in the city, I think we should more serious to take this issue. So it's like the case of the Ancol that Marco yesterday gave the picture. It's actually not the public space because the people of Jakarta we should pay if we enter this beach. So accessibility and the more inclusive public space is still the big question in Indonesia. We just have the plain urban park without any facility and also without the good design. So it's not easy for us to give the answer about the mental health and the city. The other thing that Jakarta, we start also make a bike line, but it's only limited area. So in the weekend, all of the people come to the area. So it's not a good also place when we have to avoid the crowd. So it's always contradiction in our city now. Is in my opinion, Winston. Thank you.
Thank you.
Thank you very much. So yeah, is there any reaction, any comment from our audience before? I would like to ask another question if there is no questions before. Well, this is a question, of course, this is more like a general question, but Herlambang and Wahyu, I wonder if Jakarta, based on what we have discussed so far, is still like an example or an aspiration for other cities in Indonesia. Yeah, because we are talking about from the point of view of health infrastructure, but in general, it's still an example. Can we talk about like a Jakarta? Because there is always this love-hate relationship with the city. People say, well, the city has a lot of problems. We need to relocate the city. We need to take the city to Borneo. We need to find more space and to avoid these situations in the future. But is there any like a model able to substitute Jakarta? Not only the idea from the point of view of from an ideal perspective, but also like an indigenous interpretation of what is the city and how to avoid the problems, including the health problems in the future. So the question is this: is Jakarta still the same kind of aspiration of a city elsewhere? What do you think, Wahyu?
Yeah, so before this, after this, we'll take the question by Stephen, and
okay.
Stephen will voice his question directly. Yeah, please carry on. Thank you.
Yes, thank you, Winston.
Yeah, I mean, it's a difficult question, whether Jakarta is still an aspiration for as a model city for many people in Indonesia. If we look from the perspective of the urban migrants looking for jobs and looking for a complete facilities, looking for a higher income level, Jakarta would be one of the options. Like because there are many jobs. If they're not, whether it's not in the formal jobs, because we have a lot of formal opportunities here, formal job opportunities here, that would also create need for informal jobs. People in the office would still need support from the cleaner or from the food seller, from the from the house owner who would rent their houses for the workers. So Jakarta is pretty much still a magnet for the for people from outside of Jakarta, but the city itself is growing, and there are also actually a lot of we can actually witness growth in its suburban area. So not only within Jakarta, but also in its suburban area, and that makes everything so chaotic. And that's also perhaps why larger infrastructure is being planted in Jakarta to connect its city and then its suburban area. If we look at Jokowi's infrastructure program, and then we would see how Jakarta is still pretty much in his heart, although that he wanted to relocate the city to other island, to Kalimantan, for instance. But when we look at the national government's priority of infrastructure, the toll road in Jakarta, and then the MRT, the LRT, the high-speed railways, which is also in collaboration with China government. Everything is pretty much still about how to get the city connected, integrated. So it still becomes the dream of the national government to have an integrated, a modern city in Jakarta, But also at the same time, in contradiction to that, they also want to invent a new capital city in Kalimantan. So it's still, it is indeed a very difficult question, but if we point out to the evidence, we would see that how it is still pretty much given a lot of attention by the government, but also at the same time, government would like to, switch the attention to other places. I think that's my opinion.
Very good. Thank you very much, Wahyu. Pa, any comment?
Can I share just one slide to continue our discussion about the
absolutely.
This one, we have this one is a very, very interesting picture about our president dream of about the new capital city. We can read that the new capital city is the Indonesia gift to the world. Our new capital city is the best on earth, the cleanest, the most innovative, and the uttermost. We want to install a new system. We also transfer our system, culture, working culture, and perspective. So new system, new working culture. It's like the utopian of the president of Jokowi. So we can imagine what the self-confidence in 2019 before the pandemic, what the president Indonesia think about the future. Thank you, Rafael.
Thank you very much. That's a great slide. So I think we have a question, right, Winston, from Stephen?
Yeah, so Stephen.
Hi, can you guys hear me?
Yes.
Okay. Hi, everyone. It's more of a comment, I guess, but perhaps it could morph into some questions. But actually, it's going back a little bit to the informality question, and just something that that we've found a little bit interesting in our work as well. And it comes back to something that Wahyu and Herlambang mentioned also, and in a couple of their comments about digital services. So it was, we started to talk a little bit about how, okay, like some of those are working quite well in the cities, or at least are growing pretty well in the cities, but what about other areas? And one thing that we've came across a little bit in our work, and I don't know all the details about how the Ministry of Health in Indonesia is actually doing this, but I know a little bit that they've been trying to get health centers at community levels, not necessarily village level, but sub-district level, to be doing things like, quote, remote consultations, remote appointments, other things like that. So trying to build kind of this digital remote way of being able to approach health services, health consultation at the community level, so at a lower level. And this is also partly to address issues that where it may be harder or less ideal for people to go to a health facility with COVID. But one thing that it seems like we've got indications of is if you get at the neighborhood level, and probably particularly outside of the cities and more rural areas, is that people are used to contacting like local health providers, like midwives that live in villages. They're used to contacting them really informally. So just through WhatsApp message, WhatsApp call, or, maybe they go directly to their house. And that ends up falling outside of like the system that, the Ministry of Health is trying to create with these, quote, official remote consultation appointments and things like that. So, and we've seen this a little bit in surveys as well, where surveys are saying, oh, people are not really using the online appointments, or they're not using the remote consultations. And I kind of wonder if it's just because, the surveys are maybe not accounting for these more informal type of connections that tend to happen with people like midwives, but also maybe the Ministry of Health has not really integrated this more informal side of communication with health providers that tends to happen at the village level. So I just think it's an interesting point about informality is, it's great that the Ministry of Health is trying to do online appointments, so they're, they're trying to integrate remote type support, but are they making sure that that can be done informally, or that it's integrated with the way that people tend to to access health advice at the local level already? And I think there's indications that they're not really accounting for that. They're trying to start the system from the ministry and kind of push that out, but without necessarily accounting for the informality that tends to happen at the local level. So some of that could get lost, or it's just not well integrated. So sorry, long point, but that's just what I was thinking when we were talking about informality and issues with digital services.
Thank you very much. Any reaction from Herlambang, Wahyu?
Yes.
Yes, go ahead.
Yes, Stephen, I'm not expert in public health, but I read that some step in we call national health insurance system, that in the early of the presidential of the Jokowi, the government of Indonesia start to what we call made the Indonesia Health Card, Kartu Sehat Indonesia.
Yeah,
that is one, I think, the step to bridging between ordinary people, especially in the all of the area of Indonesia, with the more structural or digital data for public health. So the Kartu Indonesia Sehat, or health insurance card, is like the start to more recording, and then the basic information with chip. So I think the next step, what do you imagine about the integrated between digital and the informality in the health services, I think become possible because the infrastructure start to develop in the past 5 years. Is my opinion, Stephen. Thank you.
Yeah, hopefully. Thanks.
Wahyu, any comment before we close the session?
Yeah, I mean, thank you, Stephen, for your question. I think if we look at, so we have Puskesmas here, the local health service, which usually operates on the basis of sub-district. But if you look at sub-district in Jakarta, that can goes up to 70,000 up to 19,000 population, and that's already a quarter of the population of Yogyakarta city. So I think when you look at that numbers, it is very understandable if people don't actually know that there is this kind of service. Me personally, as a resident, also, I don't understand, I don't know about that kind of facility. But then I recently know when I got the vaccination, and then I look at the billboard saying that, oh, there is this kind of service where I can actually register online and I can get a home care service. So with that number, I think it's very understandable if people don't actually know about this service. And so about your comments on the informal health service like midwives, I think that complements the formal health service very well. I mean, people cannot directly approach when people cannot directly go to the health service, they can approach midwives, which usually you can find very easily within your neighborhood or your next neighborhood. So in here, when we goes back to your first question about flexibility, I think the combination of formal and then also informal services in every aspect, basically housing, health, transportation, it really complements it, the everyday lives of people here. Thank you.
Thank you very much, Wahyu. Do we have any other comment from the audience, Winston?
No.
Okay, very good. So I think if we don't have any other comment, it is a good time to just to wrap up and to finish for this or to close this session. So I would like to thank you all for joining this panel, and a special thanks to Prof. Herlambang and Wahyu, Kusuma, Astuti, for their comments and ideas. It was very enlightening, and the audience and people present enjoyed your conversation, and really we appreciate that. So on behalf of my colleague, Dr. Neo and Winston, we thank you for your time. We would like to invite you to the next panel, which is Justice and Resilience, Vulnerability and Inclusivity. It will be led by Stephen Ellis from Empatica in Indonesia, and Mr. Kun Tola from STT in Cambodia. So that the panel will start in 1 hour time. So we look forward to having you there and to hear your comments and feedback. Thank you very much all for your time.
And Dr. Neo.
Thank you so much,
Thank you for joining.
Thank you very much, Wahyu, for your time.
Yeah.
Thank you. Bye-bye.
Bye-bye.
Bye.
Bye.